name is Alfred Sylvester III. I'm from Houma, Louisiana, and I'm 71 years old.
Hi, I'm Matt Finn. I'm an interventional cardiologist here at CIS in Houma, Gray, and Raceland. I'm also a vascular disease specialist. I'm from nearby in Destrehan, Louisiana.
Like 12 years ago, I started having pains in both of my legs, and it started swelling up. And I know something was wrong then. Somebody recommended me to Dr. Finn, and that's how I came over here.
Mr. Alfred came to see me due to severe leg pain, worse in the right, but also in the left, also having swelling. He had very significant protruding varicose veins that had been present for over a decade.
Took me to Gray, Louisiana, and they had to take some kind of ultrasounds on both of my legs. I recall that. Oh, I still used to walk, but I was in pain. But after he did the procedure on each leg, it felt like I had two brand new legs.
We did an ultrasound to establish, that he didn't have any blood clots and to look for different causes, and also to map out the course of the veins to help develop a treatment plan for him. Based on the ultrasound, which is fairly in-depth, and it's specifically done here at CIS, we were able to provide that treatment plan. We decided on two separate procedures. First, on the left, a procedure called a phlebectomy, or a microphlebectomy is what's frequently caused. Basically, we numb up the area of the skin over the vein, and then make about 10 tiny incisions and use a hook to pull out the vein.
During the procedure, I just would relax, lay it back, because he had put some kind of medicine in my leg to deaden it up, so I won't feel anything,
Patients usually experience minimal pain, although it does sound painful. In reality, it's very well tolerated. And it's the procedure I like to use for very, very severe varicose veins, as in Mr. Alfred's case.
All I know, he did one procedure on each leg. He did the right leg first, the right leg was the bad leg, and then he did the left leg, the follow, after that.
Now, on the other leg was much less severe, but he was having some varicose veins and pain, swelling, difficulty walking. So we used a different treatment modality called VenaSeal, which is basically a sterile glue that closes down the greater saphenous vein, which was causing a lot of leak or insufficiency in that leg, leading to the swelling and symptoms. And that basically reroutes the blood flow. I like to use the analogy of rerouting traffic from the local streets to interstate. So we basically rerouted the traffic from the broke down local streets to the interstate and got the blood moving back to the heart in a much more efficient manner with that procedure.
After I left out the office, I started feeling good. I know he did an awesome job. All the pain going away. If you get the feeling, if if your legs start swelling up and then your veins start swelling up, it's best to get it checked, And like I said, I recommend you to Dr. Finn any day.
Venous disease is one of the most common conditions of any medical condition out there, and it's highly underdiagnosed and undertreated. I myself have some degree of varicose veins, and do conservative therapy to help prevent them from getting worse. So I do ask patients out there, if they are experiencing pain in their legs, swelling, visible varicose veins, that they come seek treatment here at CIS.